A day after the U.S. confirmed the first case of the Omicron coronavirus variant, President Joe Biden announced stricter coronavirus testing requirements for international travelers entering the country, an extension of mask requirements on public transportation, and a pledge to deliver 200 million more doses of the COVID-19 vaccine to other nations in the coming months. VOA White House Bureau Chief Patsy Widakuswara has the report.
Planning to visit the United States? Be prepared to follow more stringent COVID-19 protocols. In addition to being fully vaccinated, starting next week, inbound travelers, regardless of nationality, must show a negative test within 1 day of departure instead of 3 days under the previous rule.
This tighter testing timetable provides an added degree of protection as scientists continue to study the Omicron variant. And we are extending the requirement, both internationally and domestically, to wear masks for travel on aircraft, trains, public transportation through the winter months.
President Joe Biden announced the measures Thursday, together with plans to increase vaccine and booster outreach for seniors and children and making COVID tests free and more widely available. A multi-pronged strategy to deal with the new Omicron variant and avoid lockdowns. An individual who traveled from South Africa tested positive in California on Wednesday, the first Omicron case detected in the U.S. The Biden administration has restricted travel from 9 African countries, including South Africa, where the variant was first detected. In the next 100 days, the U.S. will also send an additional 200 million doses of COVID vaccine abroad.
I'll always make sure that our people are protected first, but vaccinating the world is not just a moral tool, a moral obligation that we have, in my view. It's how we protect Americans, as we're seeing with this new variant.
Doses will also be sent to conflict zones and other humanitarian settings such as refugee camps, part of a deal brokered by the administration between Johnson & Johnson and the International Vaccine Sharing Mechanism COVAX to immunize people not reached by government programs.
We work through trusted global health partners like the United Nations, other NGOs that are trusted who can get humanitarian assistance and aid, including vaccine doses, into communities.
A recent Duke University analysis said that to reach the UN's year-end goal of vaccinating at least 40% of the world's population, low and lower middle-income countries need an additional 650 million doses beyond what they are scheduled to receive from COVAX.
That might seem like a lot, but we have also projected that high-income countries, so members of the G7 and European Union, will likely have more than 800 million excess doses available that they can reallocate after taking care of domestic needs, after taking care of boosters.
While equitable distribution of doses remains an issue in many parts of the world, the bigger problem may be skepticism that COVID vaccines are safe and effective. The Biden administration says it is also helping other countries overcome vaccine hesitancy in their population. Patsy Widakuswara, VOA News at the White House.